Now, how to cut through that over-the-counter confusion. Americans spend $5 billion a year on over-the-counter pain medications for everything from headaches to backaches to muscle aches. But how do you know what to buy and what works? Dr. Marie Savard is here, and she has some answers this morning. And doctor, I'm one of those people that I get a headache and I just walk around saying, give me whatever you got. But you say we really have to think about what we're taking here.
You do. It does seem daunting because you go and you see all these choices, but it turns out there are just two main categories. So if you know what they are, you know how they work in your body, what the upsides are and the downsides, you can actually sort out what makes sense for you.
And the first one, acetaminophen?
Acetaminophen. I say that first because probably it has the longest track record of safety if you take it as directed. Acetaminophen, which is commonly referred to as Tylenol or brand names as well, is the #1 drug for painkilling that's used out there. It works directly on your brain to sort of block the pain perception. And it's very mild, so it'll work for anything from a mild headache, low back pain, but not something serious, not severe inflammation. And there are downsides. That's the big message with these over-the-counter.
What are the big ones?
The big one is your liver. It may damage the liver. So people that have liver disease and people that are drinking 3 or more drinks a day really need to either not take it at all or talk to their doctor about it. There have been also 2 studies in women, one looking at high blood pressure in women taking it long term, these types of drugs, acetaminophen, and a more recent study that just came out this month in the American Journal of Medicine looking at men and found that men who took it chronically on a long-term basis, maybe 2 or more times a week, had hearing loss.
But Tylenol's pushing back against that study. They say that if you use it as directed, there's no hearing loss, no proof.
Well, there's no question if you take it as directed, which means in the fine print, it does say occasional use or temporary use. They're not advocating that we take it long term, but the average patient doesn't hear that part of the message. They have chronic pain, they're going to take it regularly. We don't know if it's a direct link. This hearing loss could be an association. It could be just that, a link that we need more study. But people need to hear these drugs have risks, potential risks long term. Don't just pop them.
The second major category, ibuprofen.
Yes, the non-steroidal anti-inflammatory drugs. So first we have acetaminophen, mild, very safe short term. The non-steroidal anti-inflammatory drugs, and of which Motrin, Advil, and Aleve are the most popular brands, but there are many, brands that you can buy at the drugstore. Those work directly at the site of the pain. They block inflammation. They actually block a chemical called prostaglandin. So they're going to be, I think of them as a little bit stronger, but there are downsides. So, for example, they will, even after a few doses, irritate your stomach and potentially lead even to a stomach ulcer or bleeding. In long-term use, they've been associated with reducing kidney blood flow, which can lead to high blood pressure and fluid retention. So seniors especially shouldn't take these drugs. In fact, the American Geriatric Society has advised seniors in general, don't use these drugs if you can avoid taking them. So they have some great benefits, but then there are some downsides as well.
And where does aspirin fit in all this?
Aspirin is a form of a non-steroidal anti-inflammatory drug, but it has unique properties. It also thins the blood and it leads to a reduced risk of stroke and heart attack in some people. So you're hearing about that low-dose aspirin that many people are taking. The downside is stomach ulcers. It does irritate the stomach. Even that coated type that everyone thinks is safe, or the low dose, the 81 milligrams, can cause stomach ulcers and lead to bleeding. So that also has a concern. So you've got to know the benefits and the risks.
And as always, if you have chronic pain over a long period of time, go see your doctor.
Yes, find out what the cause is. It may be masking something underlying. You really want to find out. Use these pills as directed. They have great benefit, but also risks as well. And we just have to stay tuned to what some of these new ones might be.
Okay, Dr. Marie Savard, thanks very much.